Alright, so welcome to today's video. This is gonna be my first video, and I'm just gonna document. I'm just gonna share with you guys with whatever it is that I'm doing with my back, my lower back specifically, lower back, my neck as well. I have like issues with my neck and with my lower back specifically, right? What are the exact details? I can't exactly remember because there's like an entire list of them, right? There's like protrusion, bulge, stenosis, uh, DDD, right? This degeneration disease. And then what else do I have? Something that is spondylosis. I don't even know, man. I don't know. I don't know all these medical terms, right? I will maybe put up some picture over here, show you guys what are the exact conditions they actually have. But it's kind of like not the most accurate, not the most up to date. Let's put it that way. Yeah, it's not the most up to date diagnosis that I have. Yeah, I'll explain that in a different video. All right, but for this video today, I just wanna share with you guys what I'm doing. Right, like physically, what kind of like can I call it physical therapy? I don't know. Maybe it's physical therapy. I don't know what it is, but it's most definitely not from someone else. This is all from my own personal research. Right. I'm just gonna share with you guys whatever it is that worked for me, right? What worked for me personally. This video is by no means some medical advice. All right, this is not medical advice for sure. All right, I'm not a licensed medical practitioner by any means. All right, I'm just someone, an average Joe, right? An average gym goer, right? I have an athletic background, right? I came from sports. I grew up with doing sports, all right? So I kind of like messed up my entire back. My back, my spine, yeah, my spine in general, right? Everything is royally screwed, right? It's not good. It's not a good place. But thankfully, fortunately, fingers crossed, right? That it stays that way, right? It stays that way. Oh, sorry, not stay the way where it's not good. Stay in the way where right now, right? I'm better, right? Let's put it that way. I'm better. Obviously, it's not like 100% the best, right? It's by no means 100%, but I'm just, putting daily deposits into my whole workout structure in order to recover my back. So in this video, I'm gonna bring you guys with me, go to the gym, right? Maybe I'll film some workouts that I do, and then maybe I'll just talk about it a little bit, all right? Comment a little bit about it, and then if you guys want to follow what I do, by by all means, but at your own risk, right? At your own risk. This is not it's not absolute, all right? This is just what I do. I just want to make this very clear, right? Make this super crystal clear that this is not medical advice, okay? I'm just sharing with you guys and documenting what I'm going through on a daily basis. And yeah, hopefully whoever is out there who are in my shoes or who are in my shoes right now can live a better life, right? Because I understand how it feels. 100%. I really do feel how you guys feel. All right, whatever it is that you're going through right now, if you're feeling like, if you feel like death, right? Because I felt that way. I felt I was gonna die, man. Straight up, I'm just gonna say honestly, I felt like I was gonna die because I had like no hope. I feel like whatever I do is not working, and I feel like I thought that this condition of mine, right, is gonna be with me forever until basically I die, right? So it was really scary. It's a really, really scary place to be in, to have those kind of scary thoughts as well. Yeah. So, but all I'm trying to say is that there is hope. Okay, there is hope. Don't worry, guys. I will share with you guys whatever it is that worked for me, and yeah, take it as you may, and let's do this.
Alright, here's a workout. Alright, so I'm just gonna comment it a little bit, like what I'm doing in the gym. So over here, I'm just doing some warm ups. I'm just doing a little bit of stretching. Over here, I'm kind of like stretching my lower back, a little cheeky flex, didn't hurt no one. So I'm just doing some hip movement just to warm it up, right? Just to warm up the hips after sitting for so long, from driving, from work, all those good stuff. I'm pretty sure most of you guys can relate as well. So your lower back tends to get really, really stiff and locked up, especially when you have all those weird ass diseases, right? All those lower back issues like me. So here I'm just opening up my ankles, my knees, and my lower back as well, just to relax it. If you guys realize, right, whenever you guys go on a squatting position, your lower back kind of like just relaxes. I don't know about you, man, but it's just relaxing for me. Yeah, and what I'm doing here right now is it's kind of like warming up for my legs, my thighs, my quads, my hamstrings, and my glutes, right? Because I'm gonna be doing leg presses, compound movements, right? All those movements to build your leg muscle, right? Your leg muscle mass. Yeah, so this is one of the best warm-ups. If you guys can actually do it, this is what I like to do. I don't even know what it's called, man. Seriously, I have no idea what it's called, but just do this and it's like a all rounder, right? It's a good warm up for your entire lower body. All right, so over here, hamstring curls, good old hamstring curls. So over here, I'm just doing some warm up for my hamstrings because what I believe is that if you really want to bulletproof your entire legs, right, your entire legs before your actual workout, you should always start with hamstrings first. Hamstring first, and then move on to your quad warm ups. Yeah, I'm not really a big fan of stretching. Sorry, not stretching. I mean, yeah, I'm trying to say stretching, but do not warm up with stretches, static stretches. Yeah, because that's not really the best way because your muscles are all cold, right? And then it's like yeah, just imagine if you put like a frozen rubber band, right? You put a rubber band into a refrigerator and then it's being frozen up. And then you just take it out and then immediately you start stretching it. Then what's gonna happen? It's gonna snap, right? It's gonna snap, it's gonna break. And that's not a good time. Right. So think the analogy and then it makes sense for me for the most part. So what I always do is I like to warm up through movements. Yeah, that's what I like to do. Dynamic movements. So over here, after the hamstring, I did like 4 sets, and over here I do 4 sets as well for leg extensions. Yeah. So over here, my first compound movement. These are the leg presses, and I'm just doing a little bit more of a narrow stance. If you go more narrow, you'll be training more of your quadriceps, which is the muscle in front. All those good stuff, man. This is one of the best or better uh leg muscle builders, man. Especially if we have lower back issues, right? This is what I like to do because your entire upper body just is staying over there. It's not moving, right? So it's relatively safer. I'll put it that way. And obviously, when I just started, right, I can't really do it. Yeah, meaning to say, when I just got my injury. Yeah, I'll explain to you guys a little bit later. Let me just go through this entire workout first. So over here, what I'm doing the hip thrust, good old hip thrust, and I really feel that this exercise, right, is really really helpful, really helpful to rehabilitate our entire lower back because we have to strengthen, right? We obviously have to strengthen the lower back region, the lower back, and then the glutes, the hamstrings, all those muscles that is like near your spine. I just feel like the muscles that is surrounding your spine, your core, right, is of utmost importance when we are trying to recover from this entire episode of our lives. Yeah, so doing this hip thrust really helped me. And I don't really just do it with the machines. I do it at home as well. Like body weight. You guys can just do it free weight, body weight. Yeah, just by yourself. Alright, next thing is I'm doing squats right here. I'm doing like 35 kilograms. Yeah, I mean obviously I did like some warm-up sets, which is like just a body weight. Yeah, just to have a feel of it. Yeah, before going to the working sets with the weights over here. So just doing 35 kilograms. I mean, obviously, I couldn't do this when I was just injured like 1 year ago. And this obviously built up, right? It's over the course of like almost a year of slowly building my lower back up to tolerate such loads once again. Yeah, so that's what I do, man. That's what I do. Yeah. And the next thing is, yeah, look at me. I'm tired. Really tired. So over here, I'm doing the leg adduction and abduction. Yeah, basically it's just the inner thigh and the outer thigh. And I believe that all those small little intricate muscles, right, is actually arguably even more important because it plays a really important role for the supporting of our spine. Yeah, that's very important. You can see I'm dead. Right? Alright, so I was gonna give you guys like a quick how should I put it this way? Summary. Let's put it that way, yeah. Summary, debrief, whatever it is. So me doing all this workout, right? It didn't really come naturally. Not really naturally. It's more like it didn't come to me like just like that. Like I can't just do all of these movements, right? When I was just injured. When I was just injured, right? Let me tell you guys something, man. It was hell. Right? It was really, really hell. It was really, really, really difficult for me. I wasn't able to do anything, right? I wasn't able to walk, right? I'm pretty sure most of you guys can relate as well. If you guys are going through, this entire audio, this entire episode of yours, it really, really sucks, right? I understand. I understand. So doing all these movements, right? It actually not only helps me with my physicality, right? Obviously helps me with my mental strength as well. It puts me in a better place. It puts me in a better place, meaning that I the fact that I can do all these movements again, right? It just makes me feel better, right? Psychologically. I don't know, maybe it's like a placebo effect as well. The fact I can do all this, it kind of like aids me in the recovery of my lower back as well. Yeah. By no means am I saying that right now, right? My lower back is completely healed. Because I also have issues with my neck as well. Yeah. But as far as of my lower back goes, I would say right now, right? when I'm walking, when I'm standing, when I'm sitting, it doesn't bother me. I mean, fingers crossed, right? I'm really superstitious. I don't want to jinx anything, but right now, as of now, after like a year or so, right, it feels better. Definitely, it feels way better than 1 year ago. 1 year ago, I couldn't even sit for like for like 10 seconds. If I sit for 10 seconds, I start to be in a lot of pain in my lower back. Yeah, so that is the really nasty thing, man. Really, really nasty. I hate it. I really hated that point of time. So after a while, I started to get back into the gym, and then these are the movements that I'm able to do right now. Okay, I will share with you guys another video, like my entire story, because I believe that you guys need to understand and hear that as well before you guys can, maybe you guys also want to be able to do all of these movements like what I just shared with you guys, all these leg movements, right? All these lower body movements. So I'll share with you guys, give you guys more information, so you guys can understand a little bit more, and hopefully, hey, you guys can be in a better place as well. All right, so see you guys in the next video, and keep pushing, man. Keep pushing.